We'll be discussing the cardiac biomarkers. Now, what do we mean by cardiac biomarkers is whenever anyone presents with chest pain, we always think of MI, that is myocardial infarction or heart attack at its earliest. And the first thing that we do is always ECG. So ECG can tell us whether this patient has heart attack or not, because this MI or heart attack can be either ST elevation MI or it can be non-ST elevation MI. So whether it is ST elevation MI or non-ST elevation MI, in ST elevation, we'll see the ST elevation of more than or equal to 2 millimeters in the chest leads and or more than 1 millimeter in limb leads. Whereas in non-ST elevation MI, there may not be any ST elevation. So, to label any patient with MI, the patient must fulfill two out of the three criteria. What are the three criteria? Either the patient should have ECG changes, that is the first criteria, or the patient should have chest pain, which is very typical to heart attack. Like it should be substernal chest pain, it should be heaving, it should be heaviness, or it can be burning, it can be tightness. If the patient doesn't have chest pain, it can be one of the chest pain equivalent, which can be shortness of breath, weakness, lethargy, nausea, vomiting, diaphoresis, or syncope. These are all chest pain equivalents. And the third thing is the patient should have the cardiac biomarkers positive. So either of these three, if there are two things, we can label that the patient has MI. So in these biomarkers, which biomarkers we very commonly send is either it is CKMB, that is creatine kinase, myocardial specific, or it is troponin T and troponin I. Now troponins are integral part of the cardiac muscle. So we know that this cardiac muscle is a visceral or smooth muscle, and this particular muscle has this troponin I, troponin T. So whenever there is direct damage to this muscle by heart attack because of the poor blood supply, that time only this CKMB will rise, the troponin I will rise, or the troponin T will rise. One of the most important thing is usually troponin I is early to appear when compared to troponin T. And CKMB also is one of the earliest marker to become positive. So very commonly we always send either CKMB and troponin I or CKMB and troponin T. Now, these biomarkers usually appear in the blood within 3 to 12 hours. So, if we send the cardiac markers, if they are negative, we have to resend this cardiac biomarkers after 6 to 8 hours, because earlier they may not be positive, but later they may come positive. The peak of these biomarkers is around 24 hours. So they will definitely be positive if the patient has ST elevation MI or if the patient has non-ST elevation MI. If they even after 24 hours, if the cardiac biomarkers are negative, then we can label that patient has unstable angina, because the cardiac biomarker should become positive. So if they are negative, it means ki anyone having chest pain and anyone having negative biomarkers means they will be then unstable angina, especially if the repeated biomarkers are negative. One of the most important thing regarding this CKMB is this CKMB values, they return to normal within 3 days. So suppose anyone gets MI, if someone gets ST elevation MI, and that patient is treated, suppose after 4 days of the initial admission, if he again starts to get the chest pain, then how to come to know that whether this patient has a new MI or that is the same old MI for which the patient was admitted 4 days back. So that can be very easily evaluated by sending CKMB. If the repeat CKMB is high, it means this is a new MI. Or we can simply resend the troponin T and troponin I in quantitative matter. If the quantity of the troponin I has increased markedly compared to earlier troponin I or earlier troponin T, which was reduced, then only we can say that the patient is having new MI. So if you simply want to diagnose that after 3 days, if the patient is again having chest pain or if the patient again shows ECG changes, then we can resend the CKMB to tell whether the patient again has a new block or again has block in the stented artery. So the troponin I do come back to normal within around 10 days, whereas troponin T lasts for a longer period to up to 14 days. That is the reason why troponin T or trop T is very commonly sent with CKMB. So that's all for today, and thank you.